Right now, we have, I think, from Healthcare LA, Jackie Hernandez. You're here. Okay, great. We all want to welcome Jackie Hernandez from Healthcare LA. Speaker talking about some of the conditions in the Latino community. Okay, let's give her a hand. Hi, Jackie.
Hello, everybody. Thank you for having me today. Just a little bit about myself. My name is Jacqueline Hernandez. I have an MPH in community health education. I'm a health educator as well right now with the PHC Council program, which works with a lot of different groups like Kiwa, Thai CDC, the garment center workers, and other workers that are affected right now from the pandemic. So right now, that's kind of my focus. I've been working a lot with COVID-19 as a contact tracer, as a health educator. And I've seen so much going on with workers to the point that I understand even more so. Before we even had the pandemic, workers already suffered from health conditions in the workplace. They suffered not only conditions from the workplace, but they could not even get health care in many places, even if you had a job. So here I'm going to be talking a little bit about my story as well, how that connects to a lot of the issues that we all experience because we all work here, right? Or we have a parent who needs work, or even our elderly are working right now because there's no long-term care. There's no way for our communities to actually get the care they need. So I just wanted to talk a little bit about, I always translate myself, so you're going to see some stuff in Spanish. It is part of my mission to also always advocate for bilingual care, and that includes me translating my slides in Spanish. So a little bit about myself, I just have some information here just for you to read. I'm not going to read off of this, but one of the biggest issues I believe in the Latina community, and not just in the Latino community, but in all communities that are multicultural, we see and we have talked about today the need for these services because it ensures that we are heard, that we have dignity, and that we are actually getting care that is quality care. So I'm a child of immigrants. My parents were Mexican. And throughout my whole life, when I was a little girl, I had to translate everything for my parents. And I was just a child. I had no idea what really some documents said. I was barely learning to read. But it was a need for our survival. And I feel like a lot of families who have child of immigrants who do not speak English, we do rely on our children to survive. To hopefully they have some grasp of what's happening and they hopefully help us fill out the documents, the paperwork, all of that. But when it comes to the doctor, this is where our lives is also very much in danger. And I really say danger because it's true. When I was a little girl too, we would go to the doctor and whatever was happening to my mom or my dad or even myself, who could explain to the doctor what was happening to us, what we were feeling, what we were thinking? It was difficult because they would use simple words, simple language. Some of them tried, right? A lot of them do, come from a background where they're trying to understand us and trying to communicate with us, but most of the time it's not enough. And we know that because most of the time when, I would have a diagnosis and it wasn't what was wrong with me. They would give me medication, and at the end of the day, it wasn't really what was going on. So we would have to go back again. And those are issues that some white communities don't experience. People who speak English don't experience. They go to the doctor, they understand, all right, black, you go to get your prescription, you're good. For us, it's not like that. And then I came to the point when I was 16, I had actually had a surgery that time for my tonsils. This was before my dad got his spine injured construction worker, because he's a construction worker and that always takes a toll on you. So he was working in construction since he was like 17. So for him, it was, the toll that you take on your back and you're working hard and you're doing everything that you need to do to get your family through. And then you bust your back. And all of a sudden, the employer doesn't want to take the toll that it was at work site. They take you off the health care. Now your entire family doesn't have health care. That's happened to me, and thankfully I had that surgery before that happened, because if not, I would have died. I mean, where would I get health care? Or how much would my health care bill be? So health care should not be tied to employment, and I learned that at an early age. I was calling insurance companies, being like, hey, you know, I need to know what's going on. I was only 16. Again, I'm the person who needs to translate for my family. No one could tell me anything. I would be hours on the phone crying, trying to get an answer, trying to understand. Like, how can we get health care? Why would you need to ask that question in a country that says it's the best in the world? That's not what it should be. A best country in the world will provide everyone health care, not tied to your job. Right? Right. So apart from that, let's talk about statistics, right? 39.4 is where Latinos are the highest minority in the California. And I said minority because if we all were together, all people of color were together, we would not be a minority. With that said, the immigration population is expected to grow. And with that, it's called multicultural and multilingual abilities as well, that our healthcare needs. We have the Spanish, you know, here in LA, precisely, Spanish is the second biggest, you know, spoken language. I mean, with Los Angeles, come on, we have the name even there. So we deserve to have better care. And if you go to a clinic right now, not everyone's gonna have bilingual care in whatever language you need. So that's a huge problem. The other thing that I want to point out is maybe if you also relate to this, but as a Latina, I do take herbs and I take some teas as well for some of my ailments. Some doctors shame that, and we need to have doctors understand as well that part of our culture is also some of our herbal remedies and stuff like this that we also get comfort from. We need to be respected in that sense. Culturally, we need to be understood. We need to be respected. And then right here, we have this is kind of like the reasons why bilingual care is important. We know that miscommunication causes safety issues. So if someone said a story about someone going into a hospital, a Thai person as well, and then they went to the hospital at the end of the day, they came up with the wrong diagnosis and they ended up more sick. This also causes the issues. There's also cause of more death as well because of maltreatment, misdiagnosis, these kinds of things. So what are the benefits? All of these issues that you see right here, this whole list, and this is the bigger list. I just put some of these here because the research is there, you guys. Like the research is there. There's no reason why politicians can tell you that they don't understand. We are giving them the solution. All they have to do is pass the legislation. All they have to do is that. Just the benefits here, just a list of all the things that we would get with AB 1400. And we deserve this. And I want you all to say, I deserve better health care. Say it.
I deserve better health care.
I'm a human being that is dignified.
I'm a human being that is dignified.
My community and myself need health care.
My community and myself need health care.
And I believe health care is a human right.
I believe health care is a human right.
Because we do, right?
Yeah.
These are the things that we would get, and I really hope that we spread the word as far and wide as we can because our lives do depend on this. This is to fight for our lives, everyone. So thank you so much. And this is just a quote, if you would like to read it here. But we need a translation of community knowledge is the first step to ensuring equitable inclusion of diverse populations, and I truly believe that. Thank you.
She's out there, huh? Oh man, what she's saying makes so much sense. You know, it's hard to get bilingual material. You know, if you want to talk about AB 1400, it's hard to get bilingual material. Does that make sense? I mean, I think people of color are the majority of the city, if I'm not mistaken. And 2/3 speak a different language, right? Okay, so why is it that there's no language about 1400? Wow, think about that. Now that's like outrageous. But that's fact, that's life. That's why we're having this program.